broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone. Thank you for joining our webinar today, Facing Forward, Clarity on Best Practices for Essential Business in 2021. Today's webinar is hosted by Senator Karina Villa, Senator for Illinois District 25, and Jeff Oliva, COVID Collections Services Specialist at Eurofins Clinical Diagnostics. I'm Genevieve Randall, and I will be moderating the webinar. Before we begin, I do have a few notes about today's webinar. The broadcast is being recorded, and you'll receive this recording and a copy of the slides via email within 3 business days. We'll follow the presentations with a live Q&A session during which you can submit your questions to our speakers. To submit your questions, use the GoToWebinar sidebar menu. Select the Questions tab, type in your question, and hit Enter on your keyboard. You can submit your questions throughout the webinar, and we'll follow up with any questions we don't get to during the Q&A session afterwards via email. So today's agenda for the webinar is as follows: considerations for creating a testing program, COVID-19 testing methods and modalities for employees, proactive solutions for monitoring COVID-19 spread, and real-life case studies on outbreak management and mismanagement. Okay, before we get started with the presentations, I'll let you know a little bit about Eurofins. Eurofins is a world leader in the provision of clinical diagnostics, forensic, pharmaceutical, food, environmental, and agri-science laboratory testing. Our mission at Eurofins is testing for life, and we put our full energy and commitment towards supporting the fight against the pandemic. Eurofins offers the only long-term solution on the market today that provides the comprehensive testing strategies and practical implementation approaches critical to reducing the impact of COVID-19 on your business. Okay, now I will pass it over to Will to give us a little bit of background on Cornerstone Government Affairs.
Hi, thank you, Genevieve, and thank you all for joining us today for this discussion on what manufacturers and other employers can do to help keep their employees safe. We are glad to co-host this with you. Again, we represent Cornerstone Government Affairs. We're a full-service bipartisan consulting firm, both with the federal government and in the state of Illinois. I would especially like to thank Senator Villa for joining us today and speaking about her efforts to address COVID-19 in our communities and how she's worked with employers and employees to increase safety and access to testing and vaccination resource. Senator Villa was first elected as state representative in 2018 and won election to the state Senate last fall. She's a lifelong resident of her district. She served as vice president of the West Chicago District 33 Board of Education and worked as a school social worker in West Chicago and Villa Park before running for state office. Senator Villa is the daughter of immigrant parents who are small business owners in the community. Her district is home to the highest concentration of manufacturers in Illinois, leading to unique challenges in her community to stop the spread of COVID-19, while these essential employees continue to work to make sure all of us have access to vital food and resources. I hope you'll all join me in welcoming Senator Villa to our webinar today.
Hello, everybody, and I am just so thrilled to be here to talk to you all about this very, very important topic. Before running for office, as you heard, I was a school social worker, and in that, my priorities were always education and mental health. Little did I know when I got elected, embarrassingly, little did I know that my state rep district was the home of the most amount of manufacturers in one state rep district. That quickly changed. My knowledge started to expand as I made it an effort to go and visit as many manufacturers as possible throughout my district. This was pre-COVID. And every time I would go in, I was just always surprised about all of the wonderful things that were happening right here in Illinois, manufacturers that were really changing the world. And every time I would go in, it was always the same story. They would say to me, "Representative, we need your help. We need your help because we do not have enough workforce. We need more employees." please send us anyone that you might know who might be interested in any of these jobs. They're good paying jobs. We have benefits, and please send people our way. That was something that I immediately then started to think about. How do I bring this message, especially to the high schools in the area, letting folks know in high schools and middle schools, elementary schools, that we should be talking about all of these different jobs that are to be had out in, that aren't the typical maybe college path jobs. The reason I start with this part of the conversation is because as I was enjoying my time of getting to know my district and getting to know all of these manufacturing companies, there was a sudden halt to all of that when COVID hit. And when COVID hit, one of the biggest priorities in our office was unemployment. So we started getting all of these calls about unemployment, with people saying, we really need your help. And that was the main focus until about a week in to the shutdown. I started getting phone calls from employees. Employees that knew me very well from the time that I was a child growing up. They knew me from the community because I've lived here in West Chicago my whole life. This community, West Chicago, sends workers to many of these manufacturing companies. The Latino community here has a strong place in these manufacturing companies as employees. So because of that, many of these folks knew me from church, from school, from being a school social worker, and had already established this trust with me. They started calling and telling me about the horrors that they were experiencing at work. They were extremely fearful. You see, they were told that they were essential employees. They were told, while everyone else was being told to stay home, they were being told to go to work, and that they had to report to work, and that it was essential for our lifestyle and our well-being for them to continue to go to work. Some of these manufacturing companies were amazing. They immediately put plans in place, everything from social distancing to protective equipment to reducing the lines. If there was no ability immediately to do that separation or that distancing, they cut their production. They increased their cleaning. They increased wash stations and hand sanitizing stations throughout the company. And then there were others. There were others that were, that in my opinion, did things that were so egregious against humanity that it really was just something that I just will never forget. I will never forget the phone calls of folks calling me desperate for someone to say something about what was happening to either them, their parents, their spouses, or their children. People would call me and say, what are you going to do? This immediately turned into an opportunity for me to do what I promised I was going to do, and that was to be the voice of the hard workers of my district. And so I started making phone calls, sending emails, and putting together a plan by which I was just going to continue to ask for accountability. Everywhere from the local health department on up and in between, everyone that I could think of, I was reaching out to say, please help me be a voice for the workers. Please bring attention to this issue. Throughout that time, I see that later you'll be hearing some personal testimony or personal case studies here. Through that time, I was on the phone with folks that would call and say, my mom is in the hospital, or my dad is in the hospital, or one of my best friends who works at the factory with me is in the hospital, or I have COVID and I am very, very sick and I don't know what to do. I don't have any resources to get me through this. And these were manufacturing workers. These were workers that were being told that they were essential. Then I started getting the calls, of deaths, of people who died, and hearing just the tears, and having it in a normal time, I would have loved to drive over to these people's houses and sit with them and mourn with them And instead it was the coldness of a phone call, of listening and of saying, I promise you I'm going to keep doing everything I can to bring voice to your situation. You know, eventually we were able to get back to session, and we were able to pass the workers' compensation legislation. And when we did that, it was quite interesting how quickly the calls stopped. The calls stopped, and it was, in my opinion, the correlation was that at that point, the companies knew the bad actors, and let me tell you, as I said before, there were good actors. There were very, very good actors who did what was right by their employees. And then there were those who didn't. And then there was some in between. But the bad actors who were giving hair nets, beard nets to their employees and telling them to wear that, and that was the only thing that they did to help protect their employees, a beard net for their face, being told, go ahead and keep working, this is fine. When they saw this legislation, they realized that they had no other option except for to change their practices, because they would be held liable for any of their employees who got sick at the workplace, and the onus would be on them to prove that it hadn't happened at the workplace, which would be very difficult to do if they were not meeting all of the standards, if they did not have the safety precautions in place. And so when we passed that legislation, I remember the time in which we were drafting that legislation, and I was on many, many calls with, mostly with senators. I was still a state representative at the time, on the calls with senators, and they were kind of trying to present an option A or an option B for the legislation. And they're like, this legislation, the way that it's written, we think it's going to be very, very difficult to pass. Here's another option, kind of like a watered down option. And to that I said, these calls were filled with attorneys, and I'm the social worker, right? And so I jumped in and I said to them, we will be, 10 years from now, people will write a book and they will look back and they will talk about what we decided to do at this point in time. And they will see that the people who died, all of those folks who no longer have parents because of this, and because their parents were deemed essential, and because they were attempting to provide not only for their families, but also for our communities. And they will look back and they will judge us by what decision we make now. And I think that we need to go for it all the way as it's written, and let the vote be seen. Let the vote be seen of how we as legislators, what we think about our essential workers. That day on the House floor when we voted and I stood up and gave testimony and spoke to the bill, I challenged my colleagues and I looked at them in the eyes and I said that this vote they would be judged by for the rest of their lives, for the rest of their career, for the rest of their lives. And we had an opportunity to stand with our workers and show either that we valued them or that we didn't. And in the House, folks just couldn't believe it was an almost unanimous vote with 2 representatives voting no. And that, I think, was such a win. And so I thank you all for being part of this phone call, because just being here tells me that you are on the right path and tells me that you see the seriousness of what's happened in the last year, what is still happening, that we can't let our guard down, that we can't stop with the face masks, that we can't stop with the hand washing, that we can't stop with the COVID testing and tracing. These are all critical still. And I think that it's so wonderful to have this opportunity to refresh our minds, to get back in the game and not let go of what we know that's proven to help stop the spread of this virus. So I really appreciate all of you. I thank you all for allowing me to say a few words to all of you, and on behalf of the workers of the manufacturing companies, I just really just want to thank all of you for this day and for this webinar.
Thank you so much, Senator Villa. That was very moving, and I think a great segue into our next part of our webinar today, and that will be by Jeff Oliva. Jeff, you can begin now. Thank you.
Thanks, Genevieve, and thanks, Senator Villa. That was very well said, and I think we're facing a formidable opponent in COVID-19, and I think at the end of the day, why it matters that we take action, or as Senator Villa said, for the health and safety of the workers and their families, for community health and safety, to create a safe work environment that's designed for business continuity and have the highest impact with the most cost-effective programs. And what I hope to show you today are some of the ways that you can get there without crippling your business financially or from a clinical standpoint through loss of workers. So it's important to think about how the virus spreads. And the most recent CDC update talks about people who are in close contact within 6 feet. It spreads through respiratory droplets or small particles and aerosols produced when an infected person coughs, sneezes, talks, or breathes. And there's growing evidence that these droplets and airborne particles can remain suspended in the air and be breathed by others and travel distances beyond 6 feet. So again, this aerosol spread is probably the most dangerous factor when it comes to COVID-19. But you layer on surface and other opportunities for it to spread. And again, very, very aggressive, very formidable opponent in COVID-19. The best practices in your business start with CDC guidelines. They've done a very nice job of writing workplace and business guidelines on how to plan, prepare, and respond. And I think between the guidelines and implementation is education on what really works in your workplace, how you're at risk, who is at risk, and how to take the guidelines and make them real for your business and industry. In addition to the CDC, we also have state-specific OSHA guidelines, and I've included a link in the presentation where you can go to your state and read very specific guidelines. I think the most aggressive I've seen are in California. Cal OSHA has very well-defined next steps when it comes to outbreaks and how to manage outbreaks in the workplace, as well as pretty strict fines and penalties if the process isn't followed. So I'm giving general recommendations, general testing guidelines, but if you want your state's specific guidelines, you can find those at that website. OSHA has built a pyramid of job risk classification. We simplified that here. Obviously, very high exposure risk are healthcare workers, laboratory personnel, morgue workers that do autopsies. High exposure includes restaurants, bars, retail, manufacturing, industrial, medium exposure, and so on. So OSHA has again provided good guidance on their websites, and this classification system helps you determine how your business falls in the continuum and how you should approach the pandemic with your particular business. Then when it comes to testing, you want to consider incorporating a testing program in your workplace to be prepared to respond and to control the disease. Consider an approach based on guidance for occupational risk, as mentioned before. You may include initial testing of all workers before entering a workplace. So if you're reopening, if you're preparing to reopen, it may be good to do a baseline test, periodic testing at regular intervals to catch the virus, catch those asymptomatic spreaders, targeting new workers or those that have been out for a long time, or some combination of those approaches. Again, your particular situation, and we're happy to help you with that, to build a plan that will help in your environment with your worker population. So now we're going to talk about setting up a COVID-19 testing program, and specifically about COVID-19 collection options and modalities, what to expect in the collection process from start to finish, vetting and choosing providers, testing payment options, and then applications of a COVID-19 testing program. And this is somewhat unique to Eurofins. Sentinel testing is a cost-effective environmental adjunct to human testing, and we'll get into that in more detail. So the types of tests for COVID-19, I think everyone's becoming somewhat of an expert on this by hearing it in the news every day. But by far the gold standard is the PCR test. That's polymerase chain reaction. It detects the actual RNA of the virus in a nasal specimen, primarily saliva, respiratory specimens for the most part. There's the antigen test, which detects a protein component of the virus as it gets to a certain viral load within the body. And then antibody response testing, which evaluates whether or not your immune system has responded to a past infection. So going forward, I think this will become more important as you try to prove that you have antibodies. If you've had the vaccine, may be required for travel, but most of what we've done to date have been the PCR and the antigen testing for screening of the disease. So this is something when I started working in COVID after years of healthcare experience, it was somewhat surprising to me. This chart begins with a symptomatic individual. So there are 5 days here to the left of the chart that aren't on the spectrum, where someone is asymptomatic and potentially spreading before many of the tests can pick them up. Your most sensitive PCR test, which I'll say a plug for Eurofins, we have the most sensitive PCR test on the market as evaluated by the FDA, picks up the lowest viral load, so it will catch those asymptomatic spreaders. And there are very sensitive PCR tests with low levels of detection that can catch those early infections. But if you look at the curves then for antigen testing, which is broadly used, and if you think about the White House example of testing, finding negatives and then having an outbreak, but you can see how something like this can happen because you're up to 5-6 days into the infection and the tests are still not picking up the positive COVID antibodies. So I'm sorry, antigens. So you can see the period of time that each test is effective. By far the most effective is RT-PCR with a low level of detection. And then after infection, once the body starts to defend itself, it creates antibodies. And again, those antibody tests are effective post-infection to show that, that your body has had it and that you've already prepared to defend against it in the future. How long antibodies work is still something they're determining based on the vaccines and the rollout. And that's why they talk about maybe multiple shots of the vaccine or boosters over time, because they're not quite sure how long these antibodies will last in the body. So for PCR testing, there are a few options on collection. When the pandemic first started, the nasopharyngeal swab was the primary way of collection. And I think they joke that this is the brain tickler, the one that goes all the way back in the nasal cavity and collects a specimen at the back of the nasal cavity. Fortunately, and I think there was a barrier to some people being tested. Fortunately, now we have nasal swabs, we have saliva, and some of these can be self-collected. There are home collection kits that you can self-collect a nasal swab. It's simple as rubbing a Q-tip-like swab in your nostril, at the end of your nostril for about 20 seconds, place that in the vial and send it off to the lab. And of course, there's saliva testing, and it comes down to just putting saliva in a tube and sending that off for analysis for PCR testing. And when it comes to these specimen types, the considerations are age, the health of the patient, and any coexisting medical issues. Obviously, the simpler, the better, but you also want efficacy. There's a pretty significant difference in detection levels between a saliva specimen and a nasal specimen, but studies have shown that a nasal versus the nasal pharyngeal, which is again the back of the sinus cavity, are fairly equivalent in their diagnostic capabilities. So you don't have to go all the way back in the back of the sinus cavity to get a good specimen. Nasal is most effective, and then saliva, less sensitivity, but again, ease of use. And all these specimens collected are put through RT-PCR testing, which is reverse transcriptase polymerase chain reaction, which is why we call it RT-PCR. but it's the process of copying and amplifying DNA or RNA for diagnostic use. In the case of the SARS-CoV-2, it is the RNA that's replicated, and several billion copies are made in a specific test well, and those are then measured. And if it's found in the well, then obviously it's a positive test. If not, it's a negative test. Highly accurate tests, again, the variable there is the level of detection. So how low of a level can be detected with that given test. So when you actually start to implement a program and do specimen collection, you want to work with a partner that's going to build a bespoke strategy and plan for your particular business or your particular situation. You want to establish goals for the plan. Those can be based on the pandemic status in your geography. So what's the infection rate in your community, at your business? Consider those positivity rates. Then you can determine how frequently testing needs to occur and the number of people that need to be tested. And then what's the community impact on that testing? You know, if there's a significant outbreak and there's a test shortage, you need to consider that. We haven't run into that recently, but early in the pandemic, that was an issue. And then what's next? What are you going to do with positive results? You have to give guidance for quarantining, and also contact tracing is a very effective way to help control the spread. From a collection standpoint, there's everything from a drive-through to an individual home collection. And those are based on, again, you plan for your specific business or your specific community need. Drive-throughs are attractive because of isolation and distancing. So if you have a high positivity rate, that's recommended. You could do socially distanced walk-up testing. You could do walk-in testing at company clinics or retail locations. And then, as mentioned, there are more approved self-collection kits coming on the market, and those can be done at home, FedEx back or mailed back, or sent even through Uber to be tested at the laboratory. But you do want to make sure you have symptomatic and asymptomatic patient separation. You want to avoid putting together a testing event that could become a super spreader event. If you bring people with symptoms in with asymptomatic folks, you obviously risk that. So you want to plan for social distancing, PPE of all the staff, and of course, cleaning precautions. And again, consider a drive-through if there is an outbreak. And we've done quite a few of these now with schools and other businesses where there's an outbreak in one particular class or cohort. We set up a drive-through. That particular class or cohort goes through the drive-through. Their results are provided, and you can stamp those out pretty quickly and safely if you react accordingly. And again, self-collection is a new and important option for symptomatic people. So rather than have them come into the office or come into the walk-up clinic, they can be sent a kit at home. They can do it at home and collect it and send it back to the lab via FedEx or Uber. So when you choose a testing partner, you really want to look for an expert to help you design your approach. Make sure that they are well trained on CDC guidelines for safety of PPE. Again, we don't want to create a super spreader event by testing people, so safety is critical. Make sure they have insurance and experience. Many of these companies just cropped up in the last few months because of the pandemic, which is understandable, but that doesn't mean they're necessarily experts in it. So you want to really vet your partner. Make sure they're efficient. Make sure they're staffing locally and can maintain staffing. In some of the high positivity areas, most recently Los Angeles and San Francisco, it was hard to find a healthcare professional because the outbreak had burdened the system to the point where it was really hard to find people who could do testing. So those are all considerations. And they want to have good information technology capabilities to schedule the testing, to report the testing, to interface with the lab and other healthcare entities. And of course, you want them to be budget friendly as possible. You want the most effective program at the most cost-effective price. So you and your collection partner should have a checklist and go through before execution. confirm points of contact, choose locations that meet all requirements, obtain appropriate clearances. You don't want the police to show up at your drive-through, which we have seen happen in the past. You have to get those approvals beforehand, and a good experienced partner can take care of all these for you. And sourcing gloves, sourcing PPE in a difficult time where those are limited resources are important considerations as well. And they do also add to cost. From a payment standpoint, there are federal programs for the CARES Act and others, state programs and local funding. For example, my son's school, when there was an outbreak there, they had an arrangement with a collection company for him or any other student to go over and cost-free be tested. I mean, those do exist. Medicare will pay for the test if appropriate. The CARES Act will pay for the uninsured. And commercial insurance will pay if someone has symptoms, has been exposed, or if there's a community outbreak for the most part. Of course, each individual insurance company has its own guidelines, but they have been paying for claims that are appropriate. And then there's the employer payment as well. We'll get more into how to manage that cost and be cost effective with the program, but many of the programs that we're conducting now are paid for by employers. So from a prevention standpoint, I think Eurofins is uniquely qualified here. Obviously, you take all your risk avoidance steps based on CDC and OSHA guidelines that include social distancing, room occupancy rules, mask requirements, hand washing, stay-at-home policies. You also try environmental controls, air filtration, and physical barriers, and clean and decontaminate. What's unique about Eurofins is we offer several testing modalities that tell you about the environment that your work staff are in and what the potential infection rates could be. One of those testing methodologies is worn mask testing. So you actually take the general masks that individuals wear every day. You collect up to 20 of them, 5 to 20 in a bag, send those off for testing. And you have a sentinel that tells you either have 0 cases, 0 risk, or you have several cases potentially in the population. And then next step testing can take place from there. So if you think about that from a cost standpoint and an effectiveness standpoint, you're screening up to 20 people at a lower cost than doing 20 individual tests. And this can be conducted as simply as having them throw the masks in a bag, a biohazard bag, at the end of the day. And again, no healthcare professionals are needed. So it really is a cost-effective way to monitor the population. And through studies, we found that when you take a pool of worn masks and you find a positive pool, so one person in the pool one person or more has COVID-19, then the individuals can each be tested, and you can further segment the infected from the non-infected and get them isolated based on CDC guidance and before returning to work, and protect the population that is negative and protect your business as well. The other unique testing we do is wastewater testing. It's less expensive than human population screening, but it will tell you based on, again, viral load and wastewater as to whether or not there may be an outbreak. And by monitoring that regularly, you can see in trend data over time to see if there is a spike that's coming even before anyone is symptomatic. And it's, again, a cost-effective way to test a large population with relatively low cost. We also offer air and surface testing, so you can test the surfaces if you are looking to test airborne particles, droplets, direct contact, high touch areas like elevator buttons, and sinks, and anywhere where there's a high touch from again, the workforce population or school population. You can see the amount of time this virus is stable on different surfaces. In copper, it's stable for 24 hours. In cardboard, 2 days. On plastic, 3 days. In aerosol form in the air, it's 4 hours. So it's a tough competitor, and testing will help identify and protect your workforce and the community at large. There's no specific requirements for testing, but really what's your goal with surface testing, and what is the sampling plan to adequately address, what you're trying to measure in your location. But this gives a good example of the different things you can test. Really, any surface can be swabbed, tested. These are done with a PCR test, the most sensitive test for COVID-19, but will tell you if the virus is in your environment. So Genevieve, that's my summary, and I think you're going to open it up for questions.
All right, thank you, Jeff. And before we move into questions, I'm actually going to launch a quick polling question. And that should be on your screen now. The question is, do you want a Eurofins representative to reach out to you regarding services discussed in this webinar? Select the answer on your screen now. I'll leave the poll open for about 30 seconds, and then we'll move into Q&A. I'll start checking the questions now. Okay, while we're waiting for responses to come in, I'll just start on our Q&A. Okay, our first question, should I still test employees that have received the vaccine?
Yeah, the answer there is yes. If necessary due to an outbreak, absolutely. I think there have been some cases publicized as well that people have had the vaccine and still gotten the virus and could still potentially spread it. So depending on your plan to address COVID-19 in your workplace or your environment, you would want to include those individuals in the testing.
Great, thank you, Jeff. Our next question is, what are pooled nasal swabs? I think this was on maybe your slide about the different types of sample collection methods.
Right. So pooling is a process, and I mentioned it with the worn mass testing, where you take many specimens. Our pools are of 5 individuals at our ViraCore laboratory. So you swab 5 individuals in the laboratory. Those are pooled together into one test. So you're essentially getting 5 tests done for the price of 1.5. And if that pool of those 5 individuals is positive, then the reflex then is to test the 5 individual nasal swabs and determine who in that pool of 5 actually has coronavirus. So it's a way to screen large populations with fewer tests, and really it only gets to be more expensive, if you will, if you have positive cases. If you're screening and you're looking for that maybe 2 to 5% that may have it, pooling is a way to lower your cost, as well as provide a safe environment.
Excellent, thank you. Okay, our next question is, can you give examples of goals to work towards when developing a testing strategy?
Yeah, I think the goal is to have identification. Ideally, if you could test everyone every day, you'd have the safest environment possible. And there are actually some industries that are doing that, like the film industry. Tom Cruise will tell you that's the case. But when you come into the set, depending on how close you are to the actual actors and the people who are not socially distanced, they have a cadence of testing to essentially eliminate COVID-19 in the workplace. That would be the ideal. Now, between that and your budget and your workplace, you have to work out the ideal plan for what you can accomplish. We don't all have unlimited funds to do the testing, and we do want to be able to respond when there is an outbreak. So I think your plan will be to screen, do an initial screening, and then be able to respond if you have positives or if you have symptomatic individuals in the workplace, to set up some cadence of testing so you can identify and remove the positive risk. Some of the schools we're working with are testing weekly, and they're finding that to be very effective. And we've worked the positivity rates down to less than 2%. So weekly testing is nice. It is not inexpensive, but again, somewhere between testing every day and beginning with worn mask testing or surface testing or environmental testing, those options can be built to meet your specific needs and also the specific positivity rate in your community. The higher the community spread, the more vigilant you need to be. The lower, you still need to be vigilant, but if you look at some areas of Los Angeles were above 30% positivity rates. Those are where when you're in an outbreak like that, you have to be most reactive, and then you can have a surveillance program when you're not.
Great, thank you. Our next question is, do you have recommendations for baseline testing?
Yeah, again, it's ideally when everybody comes back to work, if you've been closed, it's great to test them. If they've been on a break, like for Christmas or Thanksgiving, and they're returning, spring break is a big time for people to come back from vacation and be tested and baselined. I think if there are major events like that in your community or in your workforce, you want to plan a baseline test around those opportunities for them to not socially distance and to potentially bring community spread into your workplace. But again, based on the film industry example, the more frequently you can test, the better. Not financially viable everywhere, but if you can catch people when they are at most risk, high community spread, returning from vacation, returning from a holiday where they've been with family members who could potentially be exposed, those are key times.
Great, thank you for that guidance. Our next question is, what is the turnaround time for the PCR test?
Yeah, we're proud to say at Eurofins, it's within 24 hours of laboratory receipt in almost every case. I know that that varies by laboratory. Some of the laboratories currently that we've been dealing with in Northern California, non-Eurofins laboratories, it's been up to 7 days. And the response from a quarantining, stay at home, protecting, a potential outbreak, it's so important to have good turnaround time. If you don't know for 7 days, this 7-day asymptomatic person has been spreading COVID-19, throughout the workplace. So it's really important to have quick turnaround time, get a result, and be able to take action.
Excellent, thank you. Okay, our next question is, which tests can detect asymptomatic cases?
Yeah, really every test can detect asymptomatic cases. There are low levels of infection that may not be caught by the antigen tests, but a highly sensitive PCR test with a nasal swab, it will probably catch those asymptomatic spreaders. But each one has the potential to detect asymptomatic individuals. It's just a matter of their sensitivity and their detection level. And you can find those on the FDA website, actually. It's called LOD, level of detection. I think the ViraCore assay is like 125. And some of the saliva tests are 40,000 units per milliliter. So that's a huge range. And you've got your most sensitive test is going to find the early infections and your asymptomatic spreaders.
Okay, great. We have another question here. Can the self-collection kits be used for people that are traveling?
Yeah, great question. Yes, they can. And what's great about self-collection, you can have it sent to your house. You don't have to swab yourself that day when it arrives. You can save it for the required time frame before your trip. Swab yourself, send it out. Generally, the results are available. You have 1 day of shipping in most cases, so you have to take that into consideration. But typically the following day, so 48 hours out, you'll get your results. So if you plan appropriately, you can have a test result before your trip, which many countries and the airlines are starting to require. So you can do that with home collection. And again, you just need to plan when to order the kit. It can be pre-ordered and held and then sent in, 3 days before your trip to get a result that's timely.
Okay, great. Here's another question. How accurate is the worn mask testing compared to saliva or nasal swab testing?
Yeah, great question. Again, that it's as accurate as a nasal swab from a PCR standpoint. So the level of detection remains. It's the same test we use for the nasal swab. So it's very, very sensitive from a level of detection standpoint. And you can when an individual's wearing that mask all day, there's a good amount of virus that gets collected on the mask. So if they are positive, it's a very good opportunity to catch those. It's not regulated by an FDA EUA, the actual testing of the masks, but it is the same test PCR wise that is conducted on the mask. So it's very sensitive, but it's not diagnostic. It's only a surveillance and sentinel tool to tell you that there's something going on here. We've got a few cases in the pooled masks, and we need to take the next step and have PCR testing for that group of individuals.
Okay, thank you. I think this is our last question that we've received. What do I do to get testing for my facility?
Yeah, really, if you can reach out to Eurofins through this webinar or otherwise, or reach out to a laboratory provider. And there are many full service programs now. You can see we call this program Safer at Work. So we've built a program to address COVID-19 in the workplace, and it is an end-to-end solution, everything from consulting to testing to contact tracing. So we would be happy to help you, but if you go back to the choosing a partner slides that I discussed, just make sure your partner has experience, that they're providing you a safe and effective program, and has quick turnaround time, because that's critical in actually taking action to prevent widespread coronavirus in the workplace.
Excellent, great response. I actually did receive one more question. Are there any federal or state funds available to offset costs for employers?
Yeah, that may change when this next bill passes. There are some available, and they're industry specific, worker specific, and you really have to look into those. But it's worth doing the research. There's a good amount of funding for testing in this next bill if it passes, particularly aimed at schools. But testing and tracing has been a theme of the administration. So I'm hoping more federal funding is available to workplaces after this next bill passes. But from in general, I do see insurance companies paying for testing as clinically required, and that includes exposure, potential exposure, symptoms, and community spread. So there are ways to get it paid for without having to have the company pay. That's through commercial insurance, Medicare, Medicaid, the CARES Act, and potentially some grants that will come from the next bill.
All right, thank you. Okay, so that wraps up our Q&A session. Thank you all for joining our webinar today. You will all receive an email within the next 3 business days that includes a copy of the slides and also a recording of the webinar. So keep an eye out for that. It'll also be available on our website that is linked on this slide. If you have any questions or you want to get started with a testing program or other solutions for your facility and organization, you can contact Eurofins Safer at Work at the email address on your screen, saferatwork@eurofinsus.com. Thank you to our speakers today, Senator Villa and Jeff Oliva. And thank you all for joining. Have a great day.
Thank you all.